Good morning. I'm Dr. Levi Pearson from Metropolitan Pain and Spine, and today we are actually going through a video that shows Regenexx. Regenexx is actually an alternative to surgery. We're trying our best to actually address things like knee pain, hip pain, shoulder pain, spine pain, where we can actually address things that would normally be addressed with surgery. Today we actually have a three-dimensional VR demonstration of me showing a little bit of how a knee procedure is actually done. The patient actually can put on a VR headset and they're actually there in my office, and I'm explaining to them what I would normally do and as far as performing a knee injection. The knee injections are usually very simple. We actually take you into a procedure room. We sterilize the knee. I use very, very tiny needles to do this, so it's very comfortable for the patient. But this is actually demonstrating the fact that once we do it, we would be doing ultrasound or either X-ray fluoroscopy to identify the areas that need to be treated. Some of those areas may include the medial or lateral meniscus of the knee, the quadricep tendon, the patella tendon, actually the actual joint itself where cartilage loss is usually common. And also we're now keeping patients out of knee replacement, you might say, by actually injecting stem cells into the bone, because we found in studies that the bone is actually nourishing the joint. And once we can get that joint healthy, we can actually put stem cells into the bone and it will feed the joint and actually nourish the joint and regenerate a lot of the cartilage. Therefore, hopefully keeping you out of knee surgery, which is going to be a situation where most people don't know. Normally a replacement has to be replaced within several years, 10, 12 years. But it's a situation where knee surgery is something that we hopefully can prevent. Hip surgery, back surgery, things of that nature. So we're getting good results with a lot of our patients. But what he's looking at is actually me performing a knee procedure on myself. And Jordan, I'm going to have you slide to the side for just a moment. But he's actually seeing a three-dimensional video of me performing a knee procedure on myself. And I'm using ultrasound to identify soft tissue. Jordan?
Sorry.
Actually, if you're looking at the larger screen, that's me actually showing a demonstration of ultrasound, which is pain-free, being performed on my knee, letting me see soft tissue structures. Many times when you're in an orthopedics office actually doing a procedure, we actually are in a situation where the orthopedic surgeon is actually performing a knee procedure. Sometimes it's done blindly, but we do all of our procedures under some type of imaging, either ultrasound or X-ray guided fluoroscopy. So we're very accurate about looking at all of the different locations that could be causing your pain. So hopefully if someone stops by today, they'll be able to see this in 3D, which is a cutting-edge technology, but hopefully you'll visit us at Regenexx, where we can actually talk about any area of the body that may be problematic, and hopefully we can bring about good pain relief and improved function. Thank you.